Hey, everybody. I am Brian Frith Smith. I'm the office manager and marketing coordinator here at Child and Teen Counseling in Woodland Hills. Child and Teen Counseling is a nonprofit therapy organization with the goal of providing affordable therapy services to kids, teens, and families. And I am joined today by superstar therapist trainee Robert Jimenez, who will soon be an associate marriage and family therapist. That is important because today we're going to talk about the subtle distinctions and differences between different kinds of mental health professionals. Isn't that right, Robert?
Yes, it is. And thank you for the introduction. So again, hi, everyone. My name is Robert Jimenez. I'm a therapist trainee supervised by Ken Toussaint at Child Teen Counseling. So for today's topic, this is a collaboration with Insight to Teen Culture, ITC. We are going to go over the differences and responsibilities of different healthcare professionals. And I'm going to be talking about psychiatrists, psychologists, LMFTs, and life coaches. So I think shining a light on the differences of these professions may clear up any, again, misunderstandings or myths about healthcare professionals.
All right. It seems like a timely video then. So start out, tell us a little bit about what a psychiatrist is.
So again, psychiatrist, everyone kind of knows what a psychiatrist is or has a rough understanding. So basically, they are a licensed doctor. They are a medical professional. They have medical training, a medical background, and they are working with the medical model in mind. One of the biggest things I think everyone knows about psychiatrists is they're the ones prescribing medications, but they're not just doing only that. They're doing a multitude of things. They're looking at blood samples, brain scans, body scans, or kind of just whatever they feel is appropriate at the time with their patient. Now, again, these trained medical doctors have further specialized training in psychiatry, and that's just why they can do what they do. And typically when you do see a psychiatrist, you're going to see them roughly 45 minutes to an hour for the first session, but then we'll have shorter follow-up sessions.
Okay, so a psychiatrist is a doctor and they're treating these kinds of problems from a medical perspective. And if I understand correctly, I'm probably going to be stopping by the pharmacy after I see one. Is that correct?
Yes, most likely. Again, they're looking more for the physical aspect or physical ailment.
Gotcha. Okay. So now, I've sometimes I get confused here between the difference between, or I have been confused in my life between a psychiatrist and a psychologist. Uh, Tell me about what a psychologist is.
So psychologists share some similar responsibilities as psychiatrists, but again, they also do very different things. So again, psychologists, they're looking for the root cause. Again, most likely psychological in nature. Again, one huge thing is they're not allowed to prescribe drugs. Let's get out of the way. Unless they're a doctor, they cannot do that. They are considered scientists because they're doing assessments and research. They're not trained in medicine. They're trained again with a psychological background. And again, if they're going to do therapy, they're going to use more talk therapy like CBT, solution focus, or behavioral type of therapy. And with, again, when I mentioned the psychological assessments, there are a ton of psychological assessments out there. But the one I'll just give for an example is the classic you might have seen in movies or shows is called the Rorschach test. And that's the classic one where it's like a piece of paper with a little ink blot on it. And then if someone's seeing that, they'll ask you, like, what do you see? And you might say, I might see a butterfly, I might see a buffalo, blah, blah, blah. And again, just to clear up anything, it's a very cool assessment and there's a lot of information into it. So I'm not gonna give too much information, but basically, they're not gonna say like, oh, you saw a butterfly, this means you must have blank. It doesn't work like that. There's a lot more going into it. And with that, when you see a psychologist, you're gonna see them, if you're gonna have a consistent routine or schedule with them, you're gonna see them at least 50 to 60 minutes every time.
Okay, so I'm kind of confused. I've been running around my whole life kind of using psychologist and therapist interchangeably. Have I been wrong about this my entire life? Have I been labeling them incorrectly?
Well, I want to say is with licensed marriage family therapists specifically, they're trained, again, they have different type of training and different certifications. So a psychologist again might have a PsyD or a PhD, again allowing them to do these assessments or type of researches. But with LMFTs, they're looking, again, licensed marriage family therapists, they're looking at different things, slightly different things, but again, they do share some responsibilities like psychologists. So again, LMFTs are looking at interpersonal relationships or communications between people. They're viewing the whole person in context, not just kind of one thing they say and then just that. Again, they're looking at the whole picture, the greater picture. again, kind of the phrase you might be thinking of is the whole is greater than the sum of its parts. And like psychologists and psychiatrists, they can treat mental illnesses and look and heal past traumas.
I see. So that makes a lot of sense. And now I think that was also kind of a long-winded way of telling me that, yes, I have been wrong my whole life in referring to psychologists and therapists the same. Okay, so now tell me, what is the deal with all these life coaches? How do they fit into this equation?
No problem. So life coaches are a little bit different. So life coaches, really what they're doing is they're providing their clients with questions, observations, feedback, even encouragement, support, and accountability. They can act as a mentor or a guide, or even what you say, a collaborative partner. They're more solution and action oriented. They're not, again, life coaches, they're not going to treat mental illnesses or heal past trauma. That's not what they're there for. They're for solution action oriented goals. They're here to facilitate conversations and structure the coaching experience.
Okay, well, I think that, to me, it seems like we've probably cleared up like this mystery that has been surrounding these different kinds of professionals. And I expect this to become the definitive guide to that on the internet soon. Do you have anything else you'd like to add, sir?
Yes. Well, the last thing I'd like to add is just a disclaimer. Again, this video is by no means the end all be all of what these professions do and require. There is so much more information out there, but I just wanted to give a basic understanding of each profession to help clear up any other misunderstandings.
Okay, well, there you have it. So once again, I am Brian from Child and Teen Counseling, and this is Robert Jimenez from Child and Teen Counseling. Child and Teen Counseling is a nonprofit organization located in Woodland Hills. We're devoted to helping kids, teens, and families live happier lives. You can find out all about our services at childteencounseling.org, and you can also get in touch with us there. Thank you so much for joining us. Have a good one.
Thank you.
Cheers.
Thank you for watching the video. See you in the next one.